Did you know that TB is the deadliest infectious disease? It's more deadly than malaria or HIV/AIDS. Every year, 1.25 million people die from TB, and that's more than malaria or HIV/AIDS combined. It took me several years to understand how patients die from TB. My name is KJ. I'm a medical doctor trained in the United States, and I've spent over 20 years treating TB patients in poor countries where TB is completely running rampant. My first job out of residency in internal medicine was at an organization called Partners in Health in Boston. And I was sent to Peru, a South American country with a big public health problem with TB, and particularly drug-resistant TB. And at that time, drug-resistant TB was essentially incurable in these countries. The drugs, they weren't very effective. They had a lot of side effects. They were so expensive that you couldn't even get them in the countries that had the most DRTB. In the United States, patients would be hospitalized for weeks or months. And this was also just incredibly difficult for poor countries. So the idea was to create a demonstration project for the community-based treatment for drug-resistant TB. We would treat patients in their homes. There were 4 or 5 nurses, each of who were responsible for over 100 of the most difficult DRTB patients you can imagine. And every day we would make home visits, everything from these very poor shanty towns in the outskirts of Lima, but sometimes even pretty nice apartments in richer areas of the city. We would see patients who were having problems with treatment, whether it was side effects or problems staying on treatment. We'd figure out if we could make them feel better, or if not, we'd take them to see a Ministry of Health pulmonologist, a TB specialist. So one day, at the end of the day, we visited a young woman in really a pretty typical house. She looked actually a lot better than the patients that I had seen all that day. But as soon as she started talking, it became clear what the problem was. She was incredibly anxious about starting treatment for drug-resistant TB. So the nurse and I, we put away our paper and pen, and we just sat down on the bed and just had a really long talk with her for about an hour. We talked about how the treatment would proceed, that she would have a community health worker that would visit her every day, that she would take these specific drugs with these specific side effects. And if she had any of them, she needed to talk to the community health worker, or she needed to inform the nurse as soon as possible. That the first 2 or 3 weeks would be the most difficult. That was when the drugs hadn't kicked in yet. But once those drugs started killing the TB, and that bacillary load went down, she would start feeling a lot better. So after this discussion, she felt a lot more reassured. She was smiling, and so I took that opportunity to snap a photo. And I remember she was trying to make herself a little more presentable, even though she hadn't probably left her bed the entire day. Maybe she was trying to hide a little bit the fact that she had lost so much weight. I held her x-ray up to the light, to the window. And I told her, this is the best x-ray that I've seen all day, maybe all month. A few cavities in one lung, and just completely different from these horrible x-rays that I'd been seeing of patients who had been in treatment for years with just completely destroyed lungs. It was a fun encounter. There wasn't really much from the medical point of view. And I didn't think much about her until a month later when the nurse told me that she had died unexpectedly at home. Now, in settings like this, you don't do medical autopsies, especially not for a patient with a known diagnosis of a deadly disease. But I could figure out probably what happened to her. You know, one of those cavities in her lungs had eroded into a blood vessel, and that blood vessel could just erupt blood into your lung. And if it's a small amount of blood, the patient can cough it up. And that's what you see in the movies. But the lung is not designed to contain liquid. It's designed for air. And so even a moderate amount of blood can fill the airways in one lung, in the other lung, and the patient can essentially drown in their own blood. Now, there are other ways to die, a slower, more painful way to die. I saw a lot patients who had such severe disease and lungs riddled with so many cavities that they couldn't extract the oxygen from the air that they were breathing, and to asphyxiate in the last few weeks of their life. I'm telling you this story not because I'm trying to scare you. If you're a TB patient, I hope that's not what you're taking away from this video. But there's a lot of people out there who have never had TB. They never even met anybody with TB. And I think it's important for you to know how difficult it is to treat TB. Even with somebody who got the right treatment at the right time, TB can be deadly. And for medical researchers, it's important. We have to develop better diagnostics. We have to develop better treatments that are more effective and easier to take for patients. And for healthcare workers, it's a reminder as well. We have to get patients into treatment as soon as possible, just to give them the best chance for survival. Eliminating deaths from TB, which means getting those 1.25 million deaths each year down to zero, it will be very, very difficult. It's a huge undertaking, but we can do it. I hope you learned something today. I hope you enjoyed this video. If you're interested in learning more about how we can eliminate TB deaths, I've got a lot of videos. See you next time.